My name is Dr. Hillel Mazansky, specializing in medical hypnotherapy, guided visualization, nutrition and exercise. How to live a longer, happier, healthier life is my mantra. My website is drdrmedicalhypnosis.com. Today I'm going to discuss Alzheimer's disease. When one says that, it conjures up images of people who are become degenerate to the point that they're in the last stages unable to eat or drink or take care of themselves. How does one differentiate the senior moment from Alzheimer's disease? As one ages, one tends to forget short-term memory such as names and places. The long-term memory remains intact. But that is normal. Where it does become pathological is that the symptoms are far more aggravated and worse than just the senior moment. 1 in 8 people over the age of 65 in the United States develops Alzheimer's disease. And this disease is a huge drain on the family and the healthcare system because it's extremely expensive to maintain themselves. The pathology behind Alzheimer's disease is what happens. The brain begins to shrink. There are protein plaques that are deposited in the brain matter, and the ventricles, which contain the fluid, enlarge. It is those changes usually appear later on in the disease. To make the diagnosis early, however, certain psychological cognitive tests are performed, and they have the ability to diagnose and differentiate between forgetfulness of aging as opposed to early Alzheimer's disease. This is a very taxing disease, not only for the patient, but for the family as well. The early signs can be, as I said, just a forgetfulness of names and places. But as the disease progresses, so do the symptoms, to the point where they are unable to recognize family faces, friends' faces, their names, their places, the places that they've been to. They certainly have difficulty with direction and should not be allowed to drive, as oftentimes they get lost because they don't know how to return home or to go to a place that they frequently go to. Early on, as I said, the symptoms are mild, but they progress, and in the end stages, the late stages, they cannot dress themselves, they cannot eat, they become depressed, they wander around, and then paranoia develops and they become extremely aggressive, and they use incorrect objects for activities of daily living, such as instead of using a comb to comb their hair, they will take a fork or a knife and try and comb their hair. Their hygiene degenerates, and they don't change the clothes, they don't take showers or tub baths, and they stop eating. And eventually, in the very end stages where this sets in, eventually, unfortunately, they die. So what can be done to treat the disease? First of all, if the disease is diagnosed early on, there are some medications that can be used to maintain memory. If it is started later in the disease, these medications unfortunately do not help. Eating a Mediterranean diet, fish, fruit, vegetables, olive oil, tend to be protective against Alzheimer's disease. Exercise is extremely important to slow down the disease and prevent it. And obviously, a patient with Alzheimer's doesn't usually go to a gym, but allow them to walk or to work in the yard or mow the lawn, something like that is adequate exercise. The drain of the disease is not only on the patient itself, but on the caregivers. And this can be very daunting for the loved ones who take care of an Alzheimer's patient. They eventually can develop stress, headaches, tiredness, lassitude, and have difficulty in coping. Eventually, when the patient degenerates to such a point that they have to be removed from the house and placed in a nursing home where they can get expert care. Unfortunately, Alzheimer's disease is a most devastating disease, not only to the sufferer, but to the family who have to take care of the patient, because it's a long, outdrawn illness in most cases. Some cases can degenerate rather quickly, and death is more imminent in those that degenerate early as opposed to late. What can you do to prevent Alzheimer's? Well, first of all, it's important to know about a family history, because it can be genetic, and one must be alert to the fact if there was somebody in the family who suffers from the disease. The second is exercise. When you are younger, exercise as much as you can and eat food that is healthy. As I mentioned, the Mediterranean diet is healthy, lots of fruits and vegetables, fish, yogurt, olive oil, etc. That can help in staving off the disease. As mentioned, the medication initially used first for the Alzheimer's disease, but when other symptoms develop, such as depression and paranoia, other medications are added. Hypnosis or guided imagery does not work in these cases, because for that to work, you have to have comprehension. And these patients, unfortunately, have great difficulty in comprehension and executing the activities of daily living. It is a disastrous disease because it has such a severe effect on the loved ones. If you notice that your loved one is developing Alzheimer's disease, it's important to take them to the lawyer if they do not have an advanced health directive, which means telling the doctors and hospitals what they want done, what the patient wants to have done when it comes to treatment in the late stages. Their will has to be made up and intact, and all these legal documents have to be taken care of early rather than late. If they haven't been done and the patient is declared incompetent, then the court will appoint someone, usually in the family, to handle the affairs. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.